Welcome to the deep dive. Today we're tackling something critical, maybe even a bit invisible, happening in healthcare. It's antimicrobial resistance, a huge global challenge, and specifically how it relates to hospital surfaces, the things patients actually come into contact with. We're digging into some fascinating new research from the Journal of Hospital Infection. It looks at a potential breakthrough in disinfection that could really change the game for fighting superbugs. Our mission: to pull out the key insights you need on this new approach to keeping patients safer.
It's definitely a critical issue happening right now. We're talking healthcare-associated infections, HAIs, and often these are caused by multidrug-resistant organisms, MDROs, superbugs, basically.
Yeah.
And contaminated surfaces are a major source. The forecasts are pretty grim, actually. Some predict AMR infections could cause maybe 10 million deaths a year by 2050. That means worse outcomes for patients and much higher costs for everyone. It's serious.
Okay, 10 million deaths, that's
Yeah.
huge. So let's unpack this persistence issue. What makes these particular infections so hard to get rid of? Is it something beyond what regular disinfectants handle?
Well, what's really interesting here and kind of is this idea of biofilms. These aren't just free-floating bacteria that are easy to wipe away. No, they form these structured communities. They stick to surfaces, really anchor themselves, and they create this protective goo around themselves, a matrix. Think of it like a microscopic fortress.
A fortress. Okay, that sounds tough. So our usual cleaning methods, they just can't breach the walls.
Pretty much. Biofilms make thorough decontamination incredibly challenging. They're like a constant source, a reservoir for these MDROs. They even help spread resistance genes between the bacteria within them. And that protective structure, plus these specialized persister cells they have inside, it makes them way less vulnerable to the antimicrobials we typically use.
Persister cells. So even within the biofilm, some are extra tough.
Exactly. They're in a sort of dormant state, making them harder to kill off. And the scale of this, it's massive. Biofilms are linked to something like 65% of all microbial infections, maybe 80% of chronic ones. And get this, studies in UK hospitals found dry surface biofilms on up to 95% of items after terminal cleaning.
95%, even after cleaning. Wow, okay. That paints a picture. So current methods, like maybe chlorine bleach, have limitations, besides just not working well enough.
Right. Things like chlorine-releasing agents can be effective, but often need high concentrations, which can damage sensitive medical equipment. And there can be safety concerns for staff and patients, too, with fumes and residue.
Which brings us to the focus of this research: chlorine dioxide. Is this a viable alternative?
It looks very promising. Chlorine dioxide, or ClO2, is what's called a broad-spectrum oxidizing agent. That means it's really effective against a whole range of things: bacteria, even tough spores, mycobacteria, viruses, fungi. And a key difference from traditional chlorine bleach: it doesn't react as much with organic matter, like dirt or residue.
Okay, so it doesn't get used up on the gunk. It saves its power for the microbes.
That's a good way to put it. It leads to a greater killing ability, essentially. It stays potent against the actual pathogens.
So the evidence, what did this specific study find? Did it live up to the promise?
The results were pretty remarkable, actually. The chlorine dioxide disinfectants they tested showed really high effectiveness against a panel of MDROs. This included some really difficult ones, like the fungus Candidosima auris, which is notorious for being hard to treat. They met the tough European standards, showing these significant log reductions. We're talking greater than 5 or even 6 log 10.
Which means wiping out over 99.999% or even 99.9999%.
Exactly. A huge reduction in the microbial load, really effective killing.
And crucially, they looked at biofilms too, right? That fortress problem we talked about.
Yes, and this is maybe the most exciting part. Against established biofilms of 2 common culprits, Pseudomonas aeruginosa and Staphylococcus aureus, chlorine dioxide achieved over a 99.99% reduction. That's a 4 log 10 kill right on the biofilm itself.
Okay, that sounds impressive. But what about the concentration? You mentioned issues with high concentrations before.
Right, and that's the breakthrough here.
Yeah.
They saw this high level of effectiveness at much lower, safer concentrations, around 120 to 200 parts per million. Now compare that. Sometimes you need like 10,000 ppm of conventional chlorine to tackle biofilms.
10,000. Wow. That's, yeah, not practical for everyday hospital use, I imagine.
Not at all. It would damage surfaces, equipment.
Yeah.
It's just not feasible for routine disinfection. So achieving this with low concentration ClO2 is a big deal. And apparently this was the first study to show it worked in this specific biofilm model. Real new ground.
Okay. So what does this all mean for you listening? For hospitals, for patient safety?
Well, it strongly suggests that using the right disinfectant, one like chlorine dioxide that's proven effective against biofilms at safe concentrations, could be a key strategy. Better environmental cleaning can really slash the amount of MDROs hanging around, which in turn lowers the risk of patients actually getting these dangerous infections.
And there's other evidence supporting better cleaning, right? Didn't you mention a trial?
Yes, there was a randomized controlled trial that showed just increasing the frequency of cleaning cut HAIs by 34%. It makes a real difference.
34% is significant, and connecting it back to the bigger AMR picture.
If we connect this to the bigger picture, well, preventing infections in the first place means we use fewer antimicrobials, fewer antibiotics, fewer antifungals, and less antimicrobial use means less pressure on microbes to develop resistance. It's a crucial part of the AMR fight. So chlorine dioxide looks like a really strong candidate for improving hospital decontamination. Though we definitely need more clear guidance for healthcare workers on, how best to use these products, specifically targeting biofilms.
Right, practical application is key. So here's something for you to mull over. If a breakthrough in something seemingly basic, like surface disinfection, can have such a big impact on safety and superbugs, what other, maybe overlooked changes could create ripples, potentially helping solve even larger public health challenges? Something to think about.